Well, hi everybody. I know it's been a while. I wanted to give you all an update. So lately I haven't been feeling very well. Besides the brain cyst and the fibromyalgia, I've been feeling just sick. Sicker than usual. I've been having severe headaches that do not go away at all. I actually have one right now. I've been getting night sweats. I've been getting tremors. I could be fine watching TV or driving, and all of a sudden I'll just start sweating, like excessively from my forehead. Feels super warm, even if I'm under the AC. So after about 9 days of a consistent headache, my primary doctor told me that she couldn't see anything wrong on my blood work. My sedimentation rate, which is, a specific blood test, keeps going from normal to abnormal, normal to abnormal. So she was kind of, her hands were kind of tied. So she told me, since the headache medicine she gave me was not working and I was in a lot of pain, to go into the ER. Went into the ER. They admitted me into the hospital. This was this week. And at first they thought I might have something called giant cell arteritis. That's when your arteries are inflamed, and it's very dangerous. It could cause blood clots, stroke, aneurysms. So the only way to confirm that is usually by the sed rate blood test, and it has to be very high sed rate, and a biopsy of the temporal artery over here. So a couple doctors came to see me, and they said, we changed our mind. We don't think you have this, even though you have all the symptoms. Your sed rate isn't high enough. So they did not do the biopsy. So ultimately, a neurologist came and said, oh, I think you're just suffering from migraines. And so I asked to be discharged because I was just tired of the doctors playing, diagnosis ping pong with me back and forth about, you have giant cell arteritis. No, you don't. You have migraines. Oh, wait, you might have, it's just... So I was put on amitriptyline and discharged. So my doctor calls me into the office 2 days after I was discharged to tell me that my blood work showed that I have a thyroid problem. I have what she called hyperthyroidism, and that it can be the cause of my excessive sweating, my tremors, feeling warm all the time, and just not feeling well, my muscle pains. So she said I have to see an endocrinologist, which I'm going to do next week. As far as the headache, she did not say the thyroid problem is causing the headache. She's saying I have something called occipital neuralgia, where the nerve that goes along my neck to the back of my head is either inflamed or damaged, and it is causing severe, like a burning, stabbing sensation in the back of my head and along my temples. This is what they're saying I have. I would have felt more comfortable if they would have done the biopsy in the hospital just to confirm that I do not have giant cell arteritis. Because even though I'm on the amitriptyline and it's supposed to help with head pain and migraines and nerve pain, I still have the headache and I still have the pain. And it's like a constant thumping in my temples and the back of my head. So, so I got a diagnosis of occipital neuralgia, a thyroid issue, and TMJ, which is basically like a jaw disorder, because my face has been hurting, a little swollen. Sometimes there's a clicking in my jaw. I can't open my jaw very wide. If I yawn too wide, it kind of unhooks itself. So I have to see an oral surgeon for that. So I kind of feel like not quite sure if I am satisfied with the diagnosis, but I'm just going to accept what the doctors say and see an endocrinologist about the thyroid issue, and an oral surgeon about the jaw issue, and see if whatever medication they put me on helps, because this constant headache, it is just unbearable. It's not a regular headache. It's just like your whole head is thumping and your temples are thumping, and the pain in the back of the head is just unbearable. As far as the occipital neuralgia, my doctor told me that I can go to my pain doc and ask for like a nerve block, an injection in the side of my neck. So I will do that when I get a chance. But first I want to see my endocrinologist and neurosurgeon to see if can take care of some of these night sweats and the sweating that I just get randomly, and I always feel hot. As you can see, I'm flushed, so I can be under the AC and I still feel like I'm melting. So yeah. So how many issues is that now? So a brain cyst, fibromyalgia, occipital neuralgia, TMJ, and now a thyroid problem. So, I mean, I kind of ask myself, what next, right? But I still gotta stay positive and try to figure out what medicines I can get on so that I can move forward.